This video will help you understand the renal guard system when used during and post-cardiac surgery procedures. In this application, some of the functions of the renal guard system will not be used, as will be detailed in the video. Renal guard measures the patient's urine output continuously, second by second, and then automatically infuses a matching volume of hydration fluid based on that urine output volume. In other words, the urine output triggers matched infusion. If renal guard measures 100 milliliters of urine, it infuses 100 milliliters of hydration fluid. The matched hydration is being done continuously, milliliter by milliliter. Let's walk through the components of the renal guard system. The renal guard system is comprised of a console, a single-use set, also referred to as SUS, and a medical cart. The console has two weight scales, one for the IV infusion bag and one for the urine collection bag, an infusion pump, an air detector, a pressure sensor, and a touch screen interface. The IV infusion weight scale measures the volume of the infusion bag in real time and can provide alerts when the infusion bag is empty. The urine weight scale calculates the patient's urine rate in real time. It can provide alerts for low urine flow rates and full urine bag. The pressure sensor will trigger an alarm for partial or complete infusion line occlusion, and the air detector will trigger an air bubble alarm and will pause the therapy until the issue is resolved and therapy is restarted by the user. Each cardiac surgery patient requires a sterile single-use set, which includes an infusion set, a urine collection set, and a urine line extension to be used if needed based on the OR setup. The infusion set connects to the infusion bag. The infusion set includes a drip chamber, inline pressure sensor, needleless injection port, and standard Luer lock adapter. The urine collection set is comprised of a urine collection bag, narrow tubing, a Foley adapter with integrated sampling port, and a blue priming adapter that is used for priming. To begin with a new patient, the user should touch Begin New Patient. Now we're going to prepare for priming the set. Take the cap off the priming adapter and take the cap off the infusion set and connect the two together. And press prime. Prime performs a number of important functions and takes about 2 minutes. Prime fills the infusion set and urine set with infusion fluid and test all of the renal guard's functionality, including the pump, weight scales, air detector, and pressure sensor. Once prime passes and the pump stops, you will see the home screen. We are now ready to connect the single-use set to the patient. The Foley catheter and the IV peripheral catheters are not part of the renal guard single-use set. The user should use hospital's standard Foley catheter and IV peripheral catheters to connect the patient to the renal guard system. Disconnect the blue priming adapter. Connect the Foley connector of the collection set to the urinary catheter. Connect the Luer connector to the patient's peripheral IV catheter. We are now ready to start. Simply touch the Run button and the console will begin therapy. Renal guard default is to simply match milliliter for milliliter, as we discussed at the beginning. This default will be used for the cardiac surgery study. Let's walk through the options and values displayed on the screen utilized during a cardiac surgery operation. Total infusion. Total fluid infused by the renal guard system since the start of treatment. Total urine. Total urine output measured by the renal guard system since the start of treatment. Other intake and RG-AIM are not features used during cardiac surgery, and hence are not discussed in this video. Fluid balance, calculated fluid balance based on this formula. Fluid balance equals total infusion plus total other intake minus total urine. Settings. This displays current user settings. Urine rate, based on the last few minutes of urine output. In the cardiac surgery study, we aim to achieve and maintain the urine rate above 200 milliliters per hour for at least 60% of the treatment duration, as detailed in the study protocol. By pressing the urine rate box, the console will display a table with the hourly IV infusion, urine output, and average urine rate. Device mode displays the current console mode: run, stop, or pause. This concludes our introduction to the renal guard system. We hope this demonstration has been informative and valuable. Thank you for watching.